Good evening, and thank you so much for joining us on this edition of Spectrum. We are live on Radio 1 FM 90, coming to you straight from the central building here in the heart of our city, Kampala. But we are also live on our website, which is www.radio1fm90.com. You click on the icon with the word Listen Live. Now, this radio station is also live on your TV set. That's if you have a DSTV connection, you look for audio channel 897. You can also still find us on the different radio listening apps, which you can obtain from the App Store of your smartphone. You download any, look for Radio 1 FM 90, and as long as you have an internet connection, you should be able to listen to us from anywhere across this globe. My name is Kenneth Anderson Lukwago, your host, and today we'll be looking at how we can address the rising HIV transmission cases among young people in Uganda. Now, we know HIV and AIDS remain a bigger problem in our country. Efforts are underway to deal with this problem, but one of the emerging issues is the fact that there are increasing cases among young people, which implies that this challenge needs to be dealt with systematically to be able to protect the future generation. There are efforts underway by Uganda AIDS Commission, Ministry of Health, and other stakeholders involved in the fight. And they are saying that Uganda needs to meet the targets which were set to end this challenge by the year 2030. So today we have a discussion to try and understand why we have rising transmission cases among young people and what actually needs to be done to be able to deal with this problem. I have two people involved in this particular effort here in studio. I'm going to allow them to introduce themselves. Let's begin with the gentleman.
Thank you very much, and good evening, listeners. Glad to be here. My name is Boniface Epoku. I work at the Ministry of Health at the AIDS Control Program, and specifically I'm the program officer responsible for condom programming.
Right. Thank you so much, Mr. Epoku, and thank you very much for joining us this evening. Our second guest.
Good evening, our dear listeners. My name is Jimbo Shanura, a Girls Act leader from AHF Uganda Cares, the National SRHR Girl Champion Uganda, Miss Y+, and the chairperson of the AGYW Forum in Uganda.
Thank you so much. It's a pleasure having you, Ms. Shanura, on this show. All right. Very quickly, let's begin by understanding what is the current situation of HIV infection and transmission among young people in our country. You can even talk to us about Kampala and other urban places where we have so many youth.
Okay. Thank you very much. Just to take us back, as a country, we first identified the first case of HIV in 1982, and that was in Rakai district. And in the early 80s, the prevalence of HIV was really high. We're about close to over 30%. But over the years, government was able to put in place different mechanisms to bring down the pandemic. And as we talk now, the prevalence is about 5.1%, according to the latest report that was presented by Uganda AIDS Commission. There are quite a number of interventions that government has been able to put in place. You remember, those who were grown up, we had the ABC strategy, that's being abstinence, being faithful, as well as condom use. Those are the really critical strategies that brought that prevalence from over 30 to the 5.1% that we have. As a country, we've also noted that, yes, as we are making progress, for instance, in 2022 to 2023 reporting year, we realized we had about 52,000 new infections that were reported across the country. But as we progressed to 2023, 2024, we registered about 38,000 infections. So we're noticing there is a significant decline in new infections. However, what we note also, as we note the decline, but we also realize out of the new infections, out of the 38,000, close to about 36% are among young people between 15 to about 30 years. So that is quite a big number among the young people. So so we are looking at making sure that we reduce that. When you break that down, it gives you about 37 new infections among young people within that category happening every day. So the problem is big. despite the decrease, but we're seeing that specific category, the
Mm.
number of new infections seems to be going up.
All right. That leads us to another question. What could be the factors driving these new infections? I want to come to you, Jimbo, as a young person.
So there are many factors, but there are three major ones. One of them is the family. Today in Uganda, we have a lot of neglect when it comes to young people. Parents have focused more on getting money and leaving young people behind. So young people usually don't get support that they need in terms of information and behavioral change. We also have a challenge of information. Yes, we are in an era where we have a lot of sources of information, internet, newspapers, and many others. But then there is a lot of misinformation for young people, especially those in campuses, those in slum areas. In Uganda today, over the 42 years that we have lived with HIV, we wouldn't be having young people going into using those misconceptions in order to protect themselves from HIV, but it's what we are having today. Another thing is the monetary issue. A lot of young people in Uganda are not employed, and those who are employed do not get money that can sustain them in terms of their basic needs and also other ones as young people. So you find a lot of young people, especially women, involving in transactional sex, whereby they cannot even negotiate for safer sex practices. So I believe that as a country, if we are looking at ending AIDS by 2030, we shouldn't only focus on HIV prevention strategies. It is an integrated fight. We have to fight both in the economical sector in order to remove those factors that are pushing young people into these harmful practices based in the economic sector. And we also have to fight in the educational sector to bridge that informational gap. So it's just an integration of factors. Another thing is the accessibility to services. Yes, we do have condoms, a lot of condoms being distributed. We do have a lot of HIV testing services, both government-based and non-government organization. But then we go back to confidentiality. When you go to these health services and you're like seeking health services, first question they will ask you is that, why are you here as a young person? Why are you involved in these harmful practices? Not knowing that young people are dynamic in nature. Because there are some young people who are not facing challenges, for example, gender-based violence, but there are some who are facing those challenges. So all those factors integrated increase HIV infections.
All right. Well, you interact with young people, generally speaking. Have they been able to share what they think can work to be able to take back this infection? You talked about an integrated approach. You're looking at issues to do with the economy. What else can be done? Do they have views? Do they have proposals? Because, like Boniface said, this is a very critical segment of our population which needs special attention in the fight against HIV and AIDS. And to be able to do that, we actually need to involve them to be able to share the experiences and to tell us what they think can work for them.
Young people are asking to be involved into these policy changes that are happening. Not only coming to inquire that, are you getting condoms? Are you getting this? They want to be asked starting from the grassroots level. For example, if you're going to do an outreach in Katanga as a Ministry of Health, you have to first ask them, what services do you need? And if we bring this service, will you be able to access it and use it to the efficiency it needs? Because you can come with a service and young people do not appear. Not because they don't need that service, but because that particular maybe venue you have used or the approach you have used is hindering them from accessing the service, and they end up missing out. Then another thing they're asking for is legal framework, because we have a lot of bureaucracy when it comes to getting, justice in the country. Remember, HIV is an integrated issue. It also goes into gender-based violence. We have had a lot of young people who have been defiled by their uncles, a lot of young people who have been raped, young people who have been forced into transactional sex. But then they cannot fight for their rights or to get justice because the system needs you to first bring the perpetrator and then to bring evidence, which is which cannot be brought at that particular moment. So if that bureaucracy can be reduced for young people, and to find, because when you look at these systems, young people face a lot of challenges, but then when it comes to like getting justice, it's also another issue. So a young person can know this information, can have the condoms and all, but cannot use them because they don't have justice. When you don't have freedom, even if you have all the money, all the resources, you cannot get the service that you need.
All right, let's go to Boniface. Having heard from her submission there, telling you what the youth thinks can work for them, what strategies are you putting in place as the ministry, specifically to deal with these infections transmission among the young people?
Thank you very much. As I said earlier, the ministry has taken note of the rising infections among young people. So as a ministry, we have what we call a national HIV strategy, and within the strategy, it outlines different thematic areas. And specifically for the young people, we have a program that we commonly refer to as adolescent girls and young women. This program is looking out on not just issues of care and treatment, but we're also looking at all these other factors, the economic factors, the social factors that are affecting the young people. So we are working closely with quite a number of partners to be able to address those factors that are affecting the young people.
Please, if you can break down deeper, exactly, tangible,
for instance, when you're looking at, she's talked about the issues of economic challenges that the young people. So we have partners that are supporting specifically to conduct trainings that is killing these young people. We have some of them that have been enrolled into this training such as tailoring, catering and all that, so that these girls are able to start making some money for themselves. So those are some of the approaches that the ministry is taking on. Then, as I stated, the ABC strategy is still on. So for the young people as a ministry, we are saying let the young people abstain. Yes, that is the focus really. Let the young people abstain, keep away from sex until when you're ready. Those who are at school, finish school. Those who are out of school, at least get a skill that can give you an income that is able to sustain yourself. So abstinence is really the primary focus of the ministry. However, there are those who are married. I know young people, we are looking at an age group of about 15 to 30. Within there, they are married. If you're married, be faithful. Stick to your partner. I remember when we were growing up, we said, zero grazing. Keep within the spheres of your kraal. So that is what the ministry is also saying. And on top of that, in case these two fail, you've not been able to abstain, you're not being faithful, you think you can't do that, then we have the condom there. Condom is available. So those are some of the strategies that the ministry. And then the other is the HIV testing services. HIV has, the ministry, we have what we call a cascade, the 95-95-95 cascade, where we are saying 95 of the population should be able to know their HIV status. And out of those, 95 should be started on treatment. And if someone is consistent on their treatment, then they're going to achieve what we call a viral load suppression. And when someone's virus level is low, they are most likely not able to transmit that virus. So the other issue is the HIV testing services, which are available both in public and private facilities. So we call upon young people, go and test. And the benefit of testing gives you two benefits. One, you're able to know your status and you're able to know the status of your partner as well. And the second one is that if you test and you find yourself you're positive, we are now saying start off with treatment, which is key. We've realized people who are started on treatment and are consistent on their treatment, they're able to live normal life like everybody else. You're able to complete school, you're able to have the same lifespan like anybody else. So test and know your status so that you don't transmit to others in case you're positive, and then also you're able to start treatment. And once you know your status that I'm not positive, you're basically going to be able to protect yourself.
All right.
So there are other interventions. We have the safe male circumcision program That's also another strategy which we call upon the young people. Self-male circumcision has been proven to provide us some protection against HIV. Yeah, so we also have now PEP. For those PrEP, I mean, this is a medication that someone takes before they engage in a sexual act. And it gives them protection against that. The government of Uganda has even introduced a long-acting treatment on that case. So those are quite a number of interventions that the ministry is bringing on board to combat the HIV pandemic.
All right, Spectrum on Radio 1 FM 90. Our topic of discussion today, we are reflecting on the challenge of the ever-increasing infections among young people, HIV and AIDS. We are told out of the 38,000 new infections that are being registered in our country, 36% of those are among young people aged between 15 and 30 years. So I have people here in studio to discuss this particular issue, but do share with us what can we do as a country to be able to address the rising HIV transmission cases among young people. Do share with us on our WhatsApp line, which is 0703 090 090. Two guests in studio, Miss Jimbo Shanura. She is a Girls Act leader at AHF Uganda Cares. Mr. Boniface Epoko, Program Officer, Condom Programming, Minister of Health, under the HIV Control and Prevention Program. Now, let's move on. You had a response from the Minister of Health. One of the critical things they're talking about is abstinence. I've had some people actually saying that this is like hiding our heads in the sand because young people are sexually active and therefore we might not be able to succeed with that gospel. What would you say, Jimbo?
As I had said previously, young people are dynamic. Although we have young people who are sexually active, we also have those young people who are non-sexually active. So we have to balance the gospel between abstinence and also other prevention options available for those who are sexually active. Because when you look at young people, we have those who are in school and those who are out of school. So we have to make sure that we spread the gospel that those who are in school should first abstain. And also those who are engaging in sexual activities should look out for these prevention technologies available. But we have to balance it.
All right. Mr. Boniface, looking at that particular aspect of the ABC strategy that you are implementing, how are you taking it forward? Because we know spaces where young people can be actually found. Are you sitting in your ministry and talking about it, coming to Radio 1, or there's something actually happening on the ground?
Thank you very much. Yes, as a ministry, we are not sitting. So we've gone down to the ground. We've done what we call GIS mapping, whereby we know exactly where these young people are. Apparently, across the country, I've mapped about 17,200 hotspots. These are designated sites that we have been able to map and make sure that we routinely supply these hotspots with the HIV prevention commodities, including condoms and all the others. And then we also have a team of young people who are attached to health facilities. We call them peer educators and YAPs. These are very colleagues of the young people who pick HIV prevention commodities and take them to communities where the young people are. And then on top of that, we have also trained them, given them information that they go out, because we are saying, as you go, for instance, when you're going to distribute a condom or any other HIV prevention commodity, it should be accompanied with information. So we have trained these young people to be able to go out. They are more of like our ambassadors at that level. They are equipped with the skills and the knowledge to be able to explain these prevention methods as well as dispel myths about HIV prevention to their colleagues. So that work is already happening. We also have outreaches. There are points where we may not have a health facility, but we work with the facility. Our facilities move out to these specific communities and take out services there. And we, as a ministry now, we are utilizing what we call an integrated approach. When we go to a community, we just don't only go to test, but we provide a complete package, including NCDs, testing for blood pressure, for instance, is equally conducted in there, and all the others. So that is the approach that the ministry is doing, and we are really moving out to the community.
All right. And one would wonder, Ms. Shanura, what are you doing as young people to be able to deal with these infections? From your introduction, you work with the group Girls Act leader at Uganda Cares. You are a national HRH Girls Champion. You are Miss Y Plus, chairperson of another organization. Under these platforms, what are you doing as young people?
We do a lot under these platforms, and I would like to start with the Girls Act. So the Girls Act is a program under AHF Uganda Cares that looks at empowering girls in the community. Because when you look at the number of people infected in Uganda with HIV, young women between 15 to 24 are the most affected doctored. So we focus on those young people to go to slum areas like Katanga, Mulago, Kamocha, in Masaka, Guru and Soroti to spread awareness about HIV prevention, to distribute sanitary pads to these girls, and also encourage them to stay in school. Because there was a study whereby young people who have been able to attain education delay sexual debut. So that is what we are looking at. Because if young people engage in early sexual debut, they are most susceptible to getting HIV. And under the SRHR, the National SRHR Girl Champion, I have been able to go out to communities and spread awareness, not only about HIV, but also STIs and gender-based violence, in order to improve the health of these young people. So I've been doing a lot together with a group of young people. For example, under the HYW Forum, it is a group of young people who have dedicated their work into advocating for their fellows. Because if young people do not stand up for themselves, no one will stand up for them. As in, people have to find us already in the fight for them to help us and ask that, like, how may we help you? What can we do in order to help you young people? So we have been doing a lot, especially under the Girls Act program.
All right, Spectrum on Radio 1 FM 90. Let's go for a break now. When we return, we'll continue reflecting on other important issues, including what the duty bearers we have in this country can do, what can parents do, what can schools do, what can religious leaders do, what can community leaders or even cultural leaders do in order to help deal with this problem of infections among young people. Stay tuned to Radio 1 FM 90. Keep your comments coming by the WhatsApp line 0703-090-090. Our topic of discussion today, how can we address the rising HIV transmission cases among young people in Uganda? Stay tuned to Radio 1 FM 90. We'll continue. I'm glad that you're still with us on Spectrum, live on Radio 1 FM 90. We are live on our website, www.radio1fm90.com. You click on the icon with the word Listen Live, live on DSTV. That's on your TV set, where audio channel is 897. And we are live on the different radio listening apps, which you can obtain from the App Store of your smartphone. My name is Kenneth Anderson Lukwago, your host, and I have two guests here in studio, Miss Jimbo Shanura, Girls Act Leader at AHF Uganda Cares, National SRHR Girl Champion. She's Miss Y Plus. She's also chairperson of the AGYW Forum. Also in studio, Mr. Boniface Epuku is Program Officer, Condom Programming, Minister of Health, under the HIV Prevention and Control Program. Our topic of discussion, how can we address the rising HIV transmission cases among young people in Uganda? Feel free to join us using our WhatsApp line, which is 0703-090-090. Now, as a way forward, there are things that we expect some key people within our society to do, and there's what we call the social system. And I want to begin with you, Mr. Boniface. In that particular regard, what do you think the social system needs to do? First, you can help us to understand the social system in the context of fighting HIV and AIDS, and what is expected of them.
Okay, thank you very much. I think this is a very fundamental question. When you talk about a social system, this is a system around the young person. And the immediate system around the young person is the family.
Okay.
So the parents play a key role. And looking at the current situation where we are, everyone is running around to make money. So children are left at home, maybe at the care of the TV at home, or a caretaker or a house help. So that is the person who is able to address the challenges of this young person.
While you put it in that context, there are also parents who are using these young people to actually get money.
Absolutely.
That should also put that in perspective.
Yeah. So we also have parents who are putting the children. You find the young people are working in bars, in places that compromise them and expose them to contracting HIV. So I think as a family, as parents, we need to take up our role and be able to be the first advocates who are able to talk to our children about HIV, about sexuality issues. I know in this country, talking about sex, it seems more of like a taboo. A parent say maybe a father talking to a daughter about sex-related issues is a taboo. But I think where we are in this epidemic now, we need to be able to move out of the box. We need to do things that we have not done before. We are now at the top of it, which sometimes when you're climbing a hill, when you're almost about to reach the top, it really becomes difficult. So you need to think out of the box. So parents need to start talking to their children. Sexual issues shouldn't just be left to teachers or to health workers. We need to bring this discussion at home. Because most times, if we don't have this discussion here, the children and the young people are going to learn from their peers. Sometimes the information they get from their peers may not even be correct. So it's the high time that we came together and discuss these issues and make sure we dispel all the myths that the outside world would be able to give to our children. So let the children know that a home is a safe space where we can talk about sexuality issues. In case I have any challenge, my daughter should freely be able to walk to me and talk to me. I should be able to inquire from my daughter how she is feeling and start these discussions early. For instance, when the father sees the daughter has a taboo, they send her to her mom. Instead of the father coming in and support the process, maybe give her a pad or something like that. And you find this girl is now running to a boyfriend to give her the pad, and yet you, the father, should have had the discussion already. So we need to bring that family support. Let the children and the young people know that in case I have any challenge related to my sexuality, I should be able to go back home and have it discussed. So that is one area.
That's a family.
That's the family. The second area, still as a ecosystem around the young person, we have the culture around us. There are issues that culture tends to define, that this is how we always do it. So now, as a ministry, we have equally moved out. We have been engaging with religious leaders across the country. And we want to talk to them and to equip them with HIV prevention approaches, and we have been able to do trainings across the country, targeting religious leaders as well as cultural leaders. We give them talking points regarding HIV prevention. So in their gathering, HIV should be brought on board, and people should be able to freely discuss. If we talk about HIV testing, it should be something that a religious leader understands, and we are doing that. If it's about a condom, how to use a condom consistently and correctly, a religious leader should be able to do that, and we have been doing that. We have even gone further to engage the religious leaders with HIV prevention messages, and we have given them talking points which they use during their pastoral, we call them pastoral letters, during their sermons. We are saying, let's reach out to everyone. When we are looking at HIV prevention, it's not an individual issue, it's a multi-sectoral issue, and we need to bring everyone on board. So we're doing that. We're looking at culture plays a key role within us. So as a ministry, we are working with different cultural institutions.
All right. Let's now shift a little bit and hear what the young people actually need to do, or what actually they need to know in order to equip themselves to avoid these infections. Let's hear from you, Ms. Shannon.
One thing that young people can do is to look out for relevant and correct information about HIV prevention. If you are a young person and you're so passionate about preventing yourself from HIV, you have to look out information from the websites of Ministry of Health, from radios, from those trusted sources. And also young people should move away from the risky behaviors. Yes, we have young people who get HIV from different circumstances of life, but a large number of young people get these infections through like alcoholism. She was at a bar and then, things happened, drug abuse, early sex. So if you are a young person, you have to move away from these risky behaviors and protect yourself. Then another thing is to utilize the opportunities that have been given to us by the Ministry of Health and also by these non-government organizations like AHF Uganda Cares. Test for HIV. And if you find that you have the virus, take your medicine so as you prevent another person from getting the virus. And not preventing yourself just, but you are protecting your life, because if you have HIV, it doesn't define who you are. Then another thing is to avoid HIV stigma and add stigma. Like if you are a young person living with HIV, take your medicine. And if you are a young person who is not living with HIV, do not stigmatize that particular person living with HIV. Because if you are stigmatized and you're living with HIV, you will not go for the services that you need. Then another thing is, this is just a recommendation to the health workers. Give youth-friendly services to these young people, especially those living with HIV. Do not judge who they are. If a young person comes for a service about HIV, do not be so judgy about why they have come. Allow them to get the service, not just by smiling with them, because that's what people think about when you talk about youth-friendly services. Give them the service that they need with information. Let me tell you, if young people knew that safe male circumcision can reduce HIV infection by 60%, they would go for that service. But then you come at the health facility and then you're told that you have to do male circumcision and prevent yourself. You have not given the young person information about why they are doing the service. So if a young person comes, you give them information so as they can use the service needed.
All right. Spectrum on Radio 1 FM 90, a topic of discussion today. We are looking at how we can deal with the HIV infections that are said to be increasing among young people. My two guests here in studio are ready to respond to some of the issues that you're putting across and probably to be able to get ideas from you, members of the public, on what you think actually can work for us to be able to reduce these particular infections in our country. We are told actually that we get new infections, about 38,000. There are new infections. 36% of these are among young people between the age of 15 to 30%. All efforts geared towards ensuring that we end HIV and AIDS by the year 2030. What can we do to be able to address this particular challenge? Now, Shanura, you represent a group that does beauty pageants, and I think that's why you are Miss Y+. Has there been any impact from these activities as one of the prevention and prevention measures among young people as far as HIV and AIDS is concerned?
So the Y+ beauty pageant is focusing about young people living with HIV. So remember, we are preventing HIV. It means that if we start with young people who are living with HIV, encourage them to take their medicine very well, it can close the tap to new infections. Because, we have discordant couples where young people, if a person has HIV, they can live with another person who is negative and prevent the virus. So we are moving with these young people living with HIV, telling them the reasons as to why they have to take the ARVs, and also encouraging them to prevent HIV, because it starts with young people living with HIV. If they can take their medicine very well, they can prevent others from what? From getting HIV. So that is what the Y+ beauty pageant is about. It also focuses about stigma and discrimination. We have a lot of young people who have had AIDS-related deaths, but this is not because the medicine is not there. The medicine is there, but they are facing stigma and they are living the medicine, So we are looking at bridging that stigmatization and also to show the world that even if a person has HIV, that doesn't define who they are. So we are bringing all these different stakeholders into play so as we can prevent infection.
All right. Boniface, as we speak about HIV and AIDS among young people, while we are focusing on these other active ways through which they actually get it, there's also an issue of mother-to-child transmission, which is also still a challenge within our society. How are we doing in that particular area, and how can people out there prevent mother-to-child transmission?
Thank you very much. Yes, actually, elimination of mother-to-child transmission, commonly referred as vertical transmission. This is I would say a method whereby a child or a mother transmits the virus to her newborn baby. And what normally happens in such a situation, you realize the level of the virus, what you call term as the viral load, is really high in the blood of the mother. So how do we prevent that? So one
Can you tell us at what point does the infection occur?
Yeah, I'm coming to that. So one, there are two primary options. When the mother is giving birth, at the point of cutting the cord, and if this mother is not on treatment, on ART, that is antiviral treatment, so as I said earlier, the virus level is going to be up.
Okay.
So she can easily infect a newborn baby because that place is still fresh and there is contact of the blood most likely going to occur.
So it's important for an HIV positive expectant mother to adhere to treatment.
So what the approach that we are using now, whenever every mother goes for antenatal care, all mothers as a policy are tested for HIV. And once the mother is found to be positive, she is immediately initiated into treatment. So that is, and the best reason behind that is to make sure that the virus in her body is suppressed to the level that she's not able to transmit to her newborn baby. So that's one. At the cutting of the cord, that's one area where when the mother is delivering, if she's not on treatment, she can easily transmit. Then the other comes secondary. Probably the mother is breastfeeding and she's not taking her medication properly. The baby probably develops a sore in the mouth. Maybe mother develops a crack in the nipple. So during that process of attachment, if there is a crack or a nipple on the nipple and the baby has a sore, definitely there are high chances that she can transmit the HIV to her newborn baby. So we are saying let's adhere to treatment. Of course, that comes after we have tested ourselves and we've known that you're positive, adhere to your treatment.
So is there a point at any time when a mother who is HIV positive should stop breastfeeding the baby?
So apparently, we are saying at least the mother should continue breastfeeding her baby up to 6 months.
6 months?
Yeah.
And then you wean off?
Yeah. Where possible, you should be able to wean off. Yeah.
All right. Spectrum on Radio 1 FM 90, we have comments coming in, so I'll read out some of those comments and you respond to them. We have a comment coming in from Agre Musinguzi, who is listening in from Rwanda West constituency. It says, dear Spectrum, high prevalence of AIDS is due to ignorance emanating from the inadequate government schools, lack of research, and long stay of civil servants in most government offices. I don't know how that connects. The solution is simple. Let's empower all communities in the fight against HIV and AIDS. And Boniface, at a time when we had high prevalence of HIV and AIDS in our country, there was this concerted effort, politicians, religious leaders, everybody seemed to be talking about this. There were graphic messages on TV, in newspapers, showing us the impact of HIV and AIDS on the human body. Why has this effort suddenly gone away? We even had the President Yoweri Museveni. He was a champion of this, talking about HIV and AIDS at every meeting he had.
Thank you very much. And the President is still a champion of HIV prevention in this country. I think as a country we have reached a point where general population, maybe I would call it laxities, has come in, whereby people see, because of the good things that have been put in place, care and treatment, people are living longer and healthier. So people are looking at HIV like it's no longer a big threat. And then because of the treatment that people are on, people are looking healthy. The so-called the slim, the AIDS is no longer seen. So especially in this era of the young people, they have not seen that. So HIV is just basically taken like any other disease. So that laxity has come into place. But as ministry, I think we are going back there, and I think that's why we are here today. We want to communicate more and let the public know that HIV is still here, and we can do this together. Ministry can do its part, but we need the community to come on board, and we do this together. When we talk about HIV, it shouldn't remain here at the studio. Let's continue discussing it, our community meetings and those small spaces that we have and where we have influence. So the process and communication has started, and going forward, we're going to continue talking about HIV.
All right. Let's move on and continue with the discussion. And I want to come to you, Shanura. Going forward, as young people, what do you need to do as a country to be able to deal with this challenge? Let's pass on the message again, because it's very important for young people out there to understand what actually needs to be done in order for them to avoid this particular challenge.
One thing that needs to be done, and that is the main thing, is to make sure that these services are known by young people. And not just known, but understood. Because we have a large number of young people who know about PEP and PrEP, but they just know that. They don't know the use and how, like the contraindications, even what needs to be done at what particular time. So if these services are known by young people, and every information in detail is given, we can prevent the virus. And another thing is that the parents need to have talks with these young people about sexual health. Yes, these conversations may be overwhelming and overbearing at a certain point in time, but remember, whatever you're doing, you are grooming your child. So if you give them this information, and I mean the correct information, because we have parents who give their children partial information. But remember, the generation we are in is very curious. So if you don't give your child the correct information they need, another person will give it to them, and you never know what they are going to give to them. So another thing is that we have to show these children that we can be relied on. Let me tell you, we are in an era where a child cannot tell their parents that I've gone into menstruation. So will that child tell you that someone is coercing me into sexual activities? No. So we have to build that bond, like to bridge it back, especially among parents, that your child, you are the immediate contact of your child. If anything happens or they're inquiring something, they go back to you. As I said, if you don't give your child the information that they need, another person will give it to them. And also, we look at the health systems. We need confidential services. The services are there, but then there is no confidentiality, especially on the referral hospitals. You get it? For example, I was at Kayunga Referral Hospital, and the art clinic was behind, near the OPD, where everyone reaches. So people already know that those people in the corner over there are living with HIV. So will this person come for the HIV services, even if it is testing? No. Because when they sit there, even if they are looking for Oral Quick, they will be tagged as HIV positive. Or if they're HIV positive, they will be stigmatized. So we have to look at our structures in the health system, both in information and the functional structures. Are we really youth-friendly?
All right. Yeah, Boniface, she points out a very important issue of youth-friendly corners in these health centers. You come from the Ministry of Health. How do we deal with that issue?
Thank you very much. She's brought about, I brought the issue of the youth-friendly corners and those standalone, call them vertical clinics. And I think because of the issues she has brought of stigma, it's one of the issues that has driven the ministry to ensure that there is integration. If you are HIV positive, when you're going for care, you go through the normal clinic. So nobody really is able to tell that this one, so and so, has gone to the other clinic. Because all of us, at the end of the day, go to the same clinic, see the same clinician, go to the same pharmacy. So the integration approach is what the ministry is really taking on to make sure that some of these issues of stigma are being addressed. Yeah.
All right, we have a comment coming in from Maureen who says there's a lot of moral degeneration in our country. Young people are not listening to the parents, however much we tell them what to do. How would you respond to that?
There are two responses to that, because we are looking at also a generation where parents are not good examples to the young people. We have cases where parents, for example, I'll give the context of the ghetto. Remember, there are circumstances that happen. A mom works in the bar and issues happen, but yet they are looking at a greater future for their child. So that child, if you tell them that don't go to the bar, they'll be like, for you, you're going to the bar. We have parents who stay up at night in clubs, and then they are telling their young people that you should do this. So the child, it goes back to you. What example are you giving to your child? And also it goes back to grooming the child. We have children today who are growing up into adults that have been in permissive families. You cannot wake up one morning and you decide to tell your child that do this, yet from the start, you are not doing that. So it starts from like childhood. Groom that child into a responsible citizen of the country, such that when you wake up one day and you tell them, no, you should do this, they listen to you. And not only that, but we have young people, for example, in the campus. Their parents are not there in the hostels, but they'll be like, no, my mom will not like this. My dad will not like this. Why? Because they have been groomed from childhood. But then those young people who have been in families whereby, the dad is here, the mom is there, like they are on their own. We have young people who are parents of their own. So, like this goes back to what I said, build a bond with your child.
All right.
They will understand.
We have a comment coming in from Stuart. He says, you people have forgotten about the problem of cross-generation sex. Older men and older women going after young people. Boniface.
Thank you very much. I think that is a problem that we note. Yes, cross-generational sex is happening, and we remember there is also a sexual network now coming into play. Probably I'm at campus, I have somebody who is providing for my hair, then I have this other classmate who is a boyfriend. So that issue is there. And I think as young people, we need to set our priorities right. Okay? And then, of course, this comes with a supportive system. And I'm also aware there are parents who just go dump their children at campus, and that is it. How you survive there.
Hostel life.
The hostel life is really... So it calls back the entire community to come together. And then the adults also, we need to think and be able to make sure that let's not take advantage of these children because of the inefficiencies or the financial constraints that they are faced with. Let's be a supportive system as a community. Yes, I think that is what we need to go back to. Let's follow the ethics. How does our community dictate? Okay?
Shanwa, would you like to comment on this issue of cross-generation sex?
Yes. The issue of cross-generational sex brings back the point of unity that we need in the fight. For example, we have older men having sex with these young people, but we need to do awareness not only to the young people but also these older men, to remind them that if you have HIV, it's not good to transmit the virus to the young person, and keep within the age bracket. What do they call it?
Age bracket?
Yes. Because most of these young people are found when they are either very desperate or they are naive about whatever is happening. So awareness is needed in that context.
All right, we're coming to the end of this show. Very quickly, in a few seconds, your closing remarks, Mr. Boniface.
Thank you very much. Protection starts with me. So basically, as young people, let's take charge of our lives. Nobody out will come and protect you, but you protect yourself and making sure that whatever you do, your safety and your health comes first.
Ms. Shanra, your closing remarks very quickly in a few seconds.
My closing remarks are that young people, again, need to love their health more than anything. You cannot prevent HIV or live with HIV positively if you don't love yourself.
All right, with that, we come to the end of Spectrum. Thank you very much, dear listeners, for tuning in and contributing to this discussion. And thank you very much, my panelists, for showing up to sensitize Ugandans. The struggle against HIV and AIDS continues until we end HIV and AIDS by the year 2030. So do join the campaign. I've been your host, Kenneth Anderson Lukwago. Up next, we have the news in English with Miss Josephine Dagano. Thereafter, we'll have the Soul Train with BB Junior.